we certainly in here have felt like that we are preparing for battle. How do you track a virus that you can't see? This is something that we have teams of people across the country doing every day of the week. So usually our contact tracing teams are public health nurses. It is really a significant piece of detective work to ascertain all of those places and to find out where the patient might have acquired the illness, but also to find out who they might have exposed. Really the first step is an interview, and they go all the way back 14 days to where the patient may have acquired the disease. And then they go forward from when the person became sick to look at all of the places where they may have been. We sort of call it ring fencing. It's drawing a ring around the person who had COVID, finding everybody who they might have exposed and neutralizing them, so to speak. And for other illnesses, we use vaccines and immunoglobulin. Sometimes we use antibiotics to neutralise the risk of those people getting sick. But in COVID-19, we don't have any of those. There are some people who, for reasons that are unknown to all of us, seem to be more infectious than other people. In this particular scenario, it was a hospitality setting. The one person passed it on to in the vicinity of 25 people, who've then passed it on to another 15 odd people. This is something that is keeping a lot of us up at night and has been for months now.
The reason I'm ringing is just to discuss your recent arrival back into Melbourne from the cruise. So when did he become positive? The same. No one really knows what we do because we work in the background. We absolutely stop hundreds and thousands of cases of different diseases a year. Hi, it's Nectaria from the Department of Health and Human Services. How are you? The information we require is to investigate the cause of your illness and preventing further cases. Which hotel are you currently at? And you arrived there yesterday, is that correct? I'll look up your husband right now. Disease detectives, I guess. If they're a contact of somebody, so we think they've been exposed, we'll get those details through lots of different means. So it could be through the case themselves if they know them. It could be through their workplace if it's a workplace contact, through a restaurant or a cafe if they've been dining at the same time, sometimes through wedding organisers or function organisers. And we have gone through taxis and Ubers and limousine drivers and things before as well. A normal day is 12 to 17 hours a day at the moment. I think we're doing really well. I'm going to get emotional. I'm really proud of Victorians.
Basically, we look at data. We look at and we analyse data looking for patterns. My job's changed dramatically. Under normal circumstances, it could take us up to 3 months before we're ready to really say, we're ready to report on this now. These days, we do it in 7 hours. I trained as a GP, and I worked as a GP for many years before I decided I wanted to work in public health. I went to work in Sierra Leone in the Ebola response, initially as a doctor and then with WHO. Things have been extraordinarily busy and extraordinarily intense. We are working very long hours and we feel quite a sense of responsibility that the data we're seeing and the analysis that we're doing is genuinely informing decisions that are having huge effects on people's lives, and we're very conscious of that. I foster a trainee seeing eye dog puppy, which is lovely. Pippin, he's the best. And I have to admit that over the last couple of months, he has been doubling a little bit as an emotional support animal. He'll often find the desk of the person who's feeling the most stressed and just cuddle up underneath there to give a little bit of emotional support. He really is the best.
If this gets out in Victoria like it has done in other countries, No amount of people on phones is going to be able to do that when you've got tens of thousands of cases. So what we're really looking at is digital mechanisms to maintain a really complete system of contact tracing so that we can connect those dots. Where to next is a question on everybody's lips, and that is obviously being discussed at length. But I think it's really important for everybody to understand that this virus hasn't changed just because we've got lower cases than we had 2 or 3 weeks ago. There still is no vaccine at this point in time. There still is no treatment. We still have a population who is for the most part susceptible. There's still going to be a lot of difficult times ahead while we work out a way that we can function as a society but not end up at the point where we're reporting hundreds of deaths a day.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.